Welcome back. Well, assuming you've seen my talks before, these are everything you need to know, and this time I've decided to keep them shorter. Everything you need to know in 5 minutes. So let's talk about why randomized double-blind trials are so powerful. So the first thing we need to understand is, what is bias? Bias is some systematic error resulting in an incorrect estimate of the association between your exposure and your outcome. And the main two types of bias are selection bias and information bias. I think it's easier to understand these with an example. So let's pretend we're going to design a randomized controlled trial to see if a dermatology consult improves survival for patients after they have a heart attack. In the setting of a randomized trial, of course, the only thing that determines who gets seen by a dermatologist and who doesn't is a coin toss. So you expect the two groups to be pretty similar. But in a non-randomized study, this won't be the case. Maybe the dermatologist says, well, I'll only see patients once they're stable, once they're out of the coronary care unit or ICU. Well, this introduces selection bias. In the non-randomized study, where we let the dermatologist pick, by definition, their patients will be more stable and therefore have a better chance of doing well after their heart attack. So the way we remove selection bias is through randomization. And the other beauty of randomization is that it balances the patient's characteristics, both the ones we measure, measured confounders, and unmeasured confounders. So let's explain what a confounder is. A confounder is a variable that is associated with the exposure and outcome, and it distorts the association between them. So this arrow suggests that, hey, if you're seen by a dermatologist, you have better survival from your heart attack. But of course, in the non-randomized setting, we know, wait a second, the confounder here is severity of illness, and that dermatologist will only see patients, for example, when they're stable. And therefore, it's this confounder that it's explaining the association, not the dermatology consult. And when randomization works, as long as the study's big enough, the two groups will look similar. Let's say it's a drug versus a placebo. The two groups will have the same age, the same sex distribution, and the same rates of comorbid conditions like high blood pressure, prior stroke, prior heart attack, chronic kidney disease, prior hospitalization, and medications are on. These are the measured confounders, and guess what? If your randomized trial is large enough, the things you didn't measure will also be balanced, such as family history or some genetic condition. So with non-randomized studies, they can be plagued by selection bias. But there's other problems that happen with non-randomized studies. Let's say, for example, the dermatologist self-reports how their patients did. Or maybe even the patient self-reports how they did, and they want to make that dermatologist feel good, so they say, oh yeah, I had terrific care, I did so much better after my heart attack. Well, this is information bias. So how do we prevent against information bias? Mainly through blinding. When the patient is blinded and the doctor is blinded, by definition, they don't know what drug they got or didn't get, and therefore it removes that information bias. It removes the perils of self-reported data when you know what you got, for example. And a more subtle aspect of why blinding is so helpful is that it prevents patients being treated differently over time. Okay? So even in a randomized trial, sure, it balances the two groups at baseline, but if a doctor knows their patient maybe didn't get the drug and instead got the sham treatment, if it's not blinded, that doctor might then start them on some other treatment. So that's why blinding is really helpful to prevent selection bias from creeping in after the time of randomization. So hopefully I've summarized what bias is and given you examples of the two most common types of bias, selection bias and information bias. And it's the beauty of randomized double-blind trials that prevents these from ruining your study. So here's our summary on double-blind randomized trials. Randomization prevents selection bias, okay? It prevents selection bias at the time of randomization. And having both the patient and the physician and the person assessing the outcomes blinded, that prevents information bias and prevents selection bias that can occur after randomization, a week later, 2 months later. If the patient and the physician and the researcher aren't blinded, they might act differently if they know that somebody got the treatment or did not. And as I've kind of alluded to throughout the talk, you need to make sure your study is large enough in order for randomization to balance the confounders, for example. If your study's only 10 people, well, guess what? Just because of chance alone, your two groups might be really imbalanced. Whereas if you randomize hundreds or thousands of people, odds are things will be balanced. Thanks so much. I went a little bit over time, but hopefully this is helpful and you've learned why randomized double-blind trials are so powerful.